Welcome, everybody. Greetings. Great to have you here and hope that everybody who's on today is doing well. I'm really excited to have some really exciting and distinguished and brilliant panelists on with me tonight. So thank you so much for joining us late this afternoon. I'm Delegate Brooke Learman, and along with my teammates, Senator Bill Ferguson and Delegates Robin Lewis and Luke Klippinger, I represent the 46th District in Baltimore City. I am delighted to be here with you for another Briefing with Brooke webinar. I host these briefings regularly on topics that are of interest to Marylanders, everything from housing to labor and schools and vaccines. And you can check out my website, brookelearman.com/briefingswithbrooke for a full schedule of events. We have a whole bunch of great events coming up this spring, so thank you for joining. All of the briefings are posted on YouTube, and we do them on Facebook Live as well. Each briefing features experts on the topic that we're discussing. And today I'm excited to have several experts on who bring sort of different expertise on the issue of vaccinations to talk to us about how vaccinations are going, about the virus, its mutations, and about vaccine equity and making sure that we are ensuring that everybody in the state of Maryland, including those who've been so disproportionately affected, like Black Marylanders and Latino Marylanders, have access to the vaccine. So why is this important? Although the state has made tremendous progress in getting residents vaccinated, and thank you to President Biden and Vice President Kamala Harris for working so hard to ensure that states like Maryland have access to vaccines, there's absolutely still more work to be done. The pandemic's not yet over, and we're in this sort of challenging time where many people have been vaccinated and are able to be out and about more in a safe way, but not everybody's there yet. But we do know that just this week, Pfizer was approved for all those for ages 12 and up, I believe. But in terms of COVID stats, where we are as a state, we have had over 450,000 confirmed cases since the first case last year. Our positivity rate right now is a little over 3%, which is a decrease in the last day. And we are seeing our confirmed total deaths since the start of this is unfortunately over 8,600 Marylanders that we've lost. The state has administered 5.2 million doses of the vaccination so far, and 2.3 million people are fully vaccinated. So at a time when getting clear and accurate information continues to be critical, I'm really just thrilled to be joined by some national experts here to provide information and to answer questions. So first, delighted to have Dr. Sharfstein, who is the Vice Dean for Public Health Practice and Community Engagement. He's the Director of the Bloomberg American Health Initiative and Professor of the Practice in Health Policy and Management. He previously served as the Secretary of the Maryland Department of Health and Mental Hygiene, which is now the Maryland Department of Health, the Principal Deputy Commissioner of the U.S. Food and Drug Administration, and as Commissioner of Health for Baltimore City. He's an elected member of the National Academy of Medicine and the National Academy of Public Administration. Also very fortunate to have Dr. Kathleen Page here. Dr. Page is an associate professor in the Division of Infectious Diseases at Johns Hopkins University School of Medicine. Her work focuses on promoting health equity for migrant populations. She's the founding co-director of Centro Sol, which is a phenomenal program working with many of our immigrants throughout the city. And I've had the pleasure and honor of working with her through Centro Sol. And through programmatic interventions, research, and advocacy, Centro Sol addresses the impact of immigration policy on health. Dr. Page also directs the Access Partnership, TAP, which provides access to effective, compassionate, and evidence-based primary and specialty care for uninsured and underinsured residents at Johns Hopkins. And last, by no means least, I am thrilled to have Reverend Kobi Little, who is the president of the Baltimore chapter of the NAACP and the first vice president of the state conference of the NAACP. Reverend Little is an experienced and trusted leader. He's a problem solver and a community builder. He has very broad and deep policy experience on a wide range of issues, including education, community and economic development, human rights, social justice, emergency management, law enforcement, and more. He has been a tireless advocate on ensuring that our Black Marylanders are staying healthy and that they have access to the healthcare and the vaccines that they need. So really thrilled to have you all on this afternoon. Thank you so much for joining me. And we're going to start with Dr. Sharfstein. So Dr. Sharfstein, thanks for joining us. If you could give us a little bit of the state picture, what's happening at a state level and a federal level with the COVID vaccine. We're hearing supply has officially surpassed demand. Maybe you could talk to us more about that. And then possibly address, if you have any concerns about any of the COVID-19 variants and the efficacy of the 3 vaccines that we're offering and how they work against the variants. So thank you for joining us.
Sure. Thanks for having me, and it's great to see everyone here again. I'll say a few things. First of all, before we get to the vaccine, just to start with the virus itself, we're seeing a decline in cases in Maryland, which is a very good thing right now. We're not at a incredibly low level. I would say we are at a reasonably medium level of virus still, but it is headed in the right direction. People can very easily still get infected out in Maryland. There are still people in the hospital, but they're in the dozens rather than in the hundreds right now. And there are still people dying from COVID in Maryland. So it's still a serious health problem, but fortunately, and primarily because of the vaccine, we're seeing a decline, even as variants are becoming more and more common. So, this isn't the moment to, unfurl the mission accomplished banner. It's not the moment to say you're never going to wear a mask ever again. We're still in the battle. And, just like in a sports game, you don't stop playing, in the fourth quarter. You have to play the whole game. That's really where we are right now in fighting the virus. Vaccine is an incredibly important tool. It is the most important tool to protect yourself and for the greater, community. The vaccines are very effective, particularly the Pfizer and Moderna vaccines, more than 95% or about 95% effective for any disease. They really reduce the chance of passing the virus on. And the result of that is that the places that have higher rates of vaccination have a steeper decline in the number of cases, to the point where a country like Israel has almost no cases now after, vaccinating a huge percentage of its population quickly. And there's a cause and effect. The more vaccine, the less virus. So it's just so important. Now, when this all started and we had, a lot of people who really wanted the vaccine, and not that much vaccine, then it was just the deafening roar of people asking where they could get the vaccine. And, you couldn't really see the rest of the picture so much. And obviously there were enough people to fill stadiums to run out and get vaccinated. And that created its own types of problems. I think we met the last time during that situation when, it was very much the squeaky wheel that was getting the grease to a certain extent in Maryland. And there was some inequities in how the vaccine was being distributed. Now we're in a different type of situation where that excess demand has been met by and large. Everyone who is ready to go out and get vaccinated, and has the time and ability to do that has access to vaccine. But there are a lot of people who haven't gotten vaccinated yet. And so the strategy has to shift. It's not just finding more stadiums to set up and to see who comes in. We have to scale up the parts of the outreach that were starting before. And there were definitely parts of the state that were doing a particularly good job. I think Baltimore has been doing a good job. We have to keep scaling that up and keep pressing it. What frustrates me, Delegate Learman, is when people say like, well, we're never going to reach herd immunity. People aren't filling up stadiums anymore. So, it looks like we're done with vaccination. Like, I totally disagree with that. I think there are a lot of people who are still interested in being vaccinated if they can get it, very reasonable access to the vaccine, if it's in places that they trust, if they get their questions answered. And we have to keep taking vaccine out to workplaces in some cases, to churches and other faith institutions, to community areas and clinics, to people's doctor's offices. My wife works in a addiction treatment program, and they now are giving out vaccines. And the first group of people they gave it to were very high risk. And she asked them, why haven't you gotten vaccinated? It's like, it just hasn't been possible for me to figure out how to get vaccinated, or to, given my life, to get vaccinated. But now that I'm here, and I trust you, I'll get vaccinated. And so we have to have vaccine in all those places. And if we do that, we're going to capture a lot of the people who have not, capture is not the right word, we're going to help a lot of the people who have not been vaccinated get the vaccine that they want, and we'll answer people's questions. And while there may be a smaller set of people who really don't want to be vaccinated, that's much smaller than the number of unvaccinated people right now.
Thanks. That makes a lot of sense. Understood. Dr. Page, what are you seeing? It was great to visit with you in Highlandtown a couple months ago at a vaccination clinic. And how are vaccinations going among the Latino and immigrant population that you are seeing? Are there more things that we should be doing? How are people feeling? Are they feeling confident in the vaccine? Just curious about how things are going, what you see out there and what is still necessary.
Well, so I think our vaccination clinics are going still really well. As Josh mentioned, there's now thankfully a lot of vaccines. So vaccine availability is not as much of an issue. I have honestly been so impressed by the community and the efforts they're making to get vaccinated. We have, just as an example, last Friday we did walk-up vaccinations. It was raining. We announced it a few hours before, although the community health workers that work with me had done quite a bit of work during the day and the day before announcing this. And we had people standing in line in the rain. They had to wait a little bit because we had to register people, and we vaccinated 276 people. We almost ran out of vaccine. We actually did run out of vaccine and had to run off and get a couple more vials. So people are still coming despite many issues. So what I'm hearing from people is, first of all, a lot of it is, I ask people why they come to our site, and for many people, they've heard about us from their friends and family, which a lot of us have been saying all along. Once you have provide a little more access, then people can get encouraged by their friends and family to come along. Language is a huge issue and a major barrier for a lot of people. And although many of the large vaccination sites are much better now in terms of having language capacity, the reality is that a lot of people prefer to come to a place where they know that almost everyone working there is bilingual. We are also trying to be as flexible as possible with appointments, which I think is important, like to recognize that not one thing is going to fit everyone. And so some people, people can call the Esperanza hotline to get an appointment, but we are increasingly accepting walk-up appointments. As long as we have vaccination, we'll do that. And we hear that people love that because as you know, many of the people who in our community are working, they work long hours, they don't know exactly when they're going to be off. And so our clinics are all in the evening. So if they're off on Friday and they have enough time, they can come and get vaccinated. And so I think being flexible in terms of where you are, being where people are, having weekend or after hours has been helpful. And also, the last couple of weeks we've had Pfizer, so that meant we could vaccinate at that point 16 and older. And I think a lot of people are, the family units like to come together. And so the more that we can do that, hopefully now with Pfizer vaccine being approved for 12 and above, we'll see even more families coming along. So I would say that I am sure, there's no doubt in my mind, because this is normal public health, that in a month or in a couple of months, we may be getting to the point where we have vaccinated everyone who wanted the vaccine, and we really have to do the really hard work of getting to people who maybe have still not heard about how to access the vaccine, or who may still need a little bit of convincing. But right now, at least from where I stand, I still see a lot of demand and people making every effort they can to get vaccinated. So I'm really happy and proud that the community is stepping up in this way.
That's great. That's really interesting. And I love that sort of family units are trying to come together, and hopefully, as vaccines are approved for younger people, that will, even more will be able to come. So that's great. Very interesting. Reverend Little, we talked with you about equitable vaccine distribution strategy and access to vaccines and vaccine hesitancy way back in February, which feels like a really long time ago now. But I'm so curious, to hear your thoughts on how things are going. I mean, I think things started off pretty poorly, but now that there's more vaccines available, the state has stood up some websites and there's more clinics. What do you see working well? What more do you think we should be doing? What concerns you have, or what do you think is going well?
Well, Delegate Lehrman, thank you so much for the invitation to participate in this briefing. It's great work that you do. It's always good to see Drs. Sharfstein and Page, and I'm grateful for their voices and the work that they do, not only on COVID, but in Baltimore and beyond. We've heard from the public health professionals the good news. More people are being vaccinated, and there is good reason to think that brighter days are ahead. But I think we have an obligation to be learning in real time and making adjustments in real time. And so as it relates to kind of the conversation that we were having about equity in February, what we have seen from the state is mostly just an increase in their efforts, more of the state doing what they were already doing, which meant that more people were vaccinated. But what we didn't see was a comprehensive approach from the state that was integrated and without silos across the state government in partnership with public health professionals, with medical providers, and with community organizations to identify and address the equity issues that we were facing in February. And that means that we still have equity issues today. I think Dr. Sharfstein is right. Israel is a great example of showing that the vaccines work and what can happen when an entire population is vaccinated. But there's also very clear equity issues there. The Palestinians have been left out of that mass vaccination effort in ways that, are detrimental to the people of Palestine. And we have seen the same thing here. I mean, listen, in Baltimore last month, we saw a 50% spike in cases. There's nothing of infection. There's nothing that has happened since this time last year that wasn't predictable. When the pandemic first hit, there were lots of things that weren't predictable, lots of things that we didn't know. But we knew that there was going to be a spike last summer. We knew there was going to be a spike last fall. We knew there was going to be a spike over the winter. And it was predictable that there was going to be hesitancy related to the vaccine, particularly in immigrant communities and in the African-American community, not because those communities are inherently anti-science, but because there has been a consistent betrayal of trust. And we have not seen across the board an even approach to rectifying that betrayal of trust. Some institutions like Hopkins have done an excellent job. The state has been mixed. We have worked with the state to roll out information and to tell people about how to stay safe and how to get vaccinated. The state has increased manyfold community-based vaccination sites, and the governor still can't help himself and goes on TV and makes these erroneous statements. And so, that's why it's so important for us to be learning real time. There are more people just in Maryland, almost 3 times as many people died in Maryland from COVID over the last 12, 14 months than died from 9/11. But we have not heard the pronouncements about how this changes everything, about how life as we know it must be different, and then seeing the rollout of community building infrastructure, the rollout of equity creating initiatives. And, I think that's, very important. We very much need to still be pushing to warn people how dangerous COVID is. I see things differently. I don't think that we will have a clear path in a month or two that everyone who has gotten the vaccine, who wants it, will have gotten it. Because people's deciding takes place on different timelines based on what their dynamic is. There are a lot of people who think they don't need the vaccine. Our elders are safe. I haven't gotten COVID yet. I'm going to keep going.
Right.
But the truth is, the vaccine is the best shot that we have to end the pandemic. And it's not so much a matter of convincing people, but it is a matter of encouraging people, of engaging people, of having these conversations about why the vaccine is important. The research shows that personal testimonies are an important way to initiate conversations about the vaccine. And I'll just tell you all, I was vaccine hesitant in December. I was vaccine hesitant in January. I was vaccine hesitant in February. I'm vaccine hesitant today. And yesterday I got my second vaccine shot, right? But I'm still vaccine hesitant. And the reason I'm vaccine hesitant is not so much that I question the science, but it is very much a question of the intersection between politics, public policy, and profit. We have seen from each of these companies, Pfizer, Moderna, and particularly Johnson & Johnson, statements that were driven by profit motives that don't necessarily jive with the science. Like we saw Johnson & Johnson say that Pfizer and Moderna are likely to have the same amount of blood clotting as with Johnson & Johnson. We've seen, thank God for the Biden administration. Thank God for new leadership at the CDC. Trump set us on the absolute wrong tone. He is responsible for the hundreds of thousands of deaths in the United States. But the fact of the matter is that even the Biden administration and this current CDC have been politically motivated when they talk about the virus. So all of the rollout around reopening schools in the first 100 days, that was politically motivated. The science didn't support it. And certainly the social science didn't support it. And it's the same thing when we talk about the people who've already been vaccinated. We are now at risk for having two classes of people in this country, people who are vaccinated and have certain rights, and people who are not vaccinated who don't have those same rights. And so, one of the errors from the Biden administration is to issue this guidance that says that people who have already been vaccinated don't have to wear their masks. That's bad news, because public health is not about the individual. Public health is about maintaining the collective security. And so collectively, we should all be wearing our masks until none of us have to wear our masks, or until the vast, 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 vast majority of us are protected. And so the Biden administration has fallen down on that. People who were eating at restaurants, whether they're vaccinated or not, they're already not wearing their masks. So telling people you don't have to wear their mask is telling them you don't have a responsibility for the greater good. You've done your part. You can do what you want to do. But that's not how pandemics work. And so there's still a lot of work to be done. And we still must really drill down on these equity issues, whether they're related to national origin, whether they are related to ethnicity and race, whether they're related to levels of economic insecurity or security. There's still a lot of work to be done. And so, to that end, the Baltimore branch is still continuing to reach out to partners. We have rebranded our mobile public health education unit to say stop the summer surge, to encourage people to think about the vaccine and to do what they need to do to get clarity on their hesitancy issues. For me, the risk of not getting the vaccine was greater than the risk of getting the vaccine. And that's why I got the vaccine. Yeah. And, I want to share that message with people. This is not, unfortunately, this is not one of those perfect situations where we know everything and we can guarantee everything.
Yeah.
There are risks associated with it all. But the question is, when you put the risk in the balance, what's the right choice for you? And for
Right.
me, Delegate Lehrman, the right choice was to get vaccinated.
Yep. No, I appreciate that. A couple questions that folks had were, one was, how do we do outreach to those that are vaccine hesitant? And, I was in Hagerstown last week, and we were talking about how that county they've really plateaued around 20%. And, people are not wanting to get the vaccine, and making sure that we have trusted messengers, right, is really important. But curious, your thoughts on ensuring to do outreach to those. There are, different populations of folks who are vaccine hesitant. Maybe it's political, maybe it's, historical racism, but just, there are different populations. So curious about that. And then sort of in tandem with that is, what successful models of going into the community to vaccinate people have you seen that Maryland should replicate, or maybe that are happening in some communities in Maryland that can be replicated successfully around the state? And I'll just open that up to any of you.
Well, I certainly think that there are a few strategies that will be successful, and it's important to think about vaccine hesitancy as about more than just people deciding yes or no, because they're often on a spectrum. They can have questions answered. And the more convenient the vaccine is, and the more it's available in a trusted location, the more likely they are to get vaccinated. So somebody who, say, is Dr. Page's patient, who's being asked to go to an unfamiliar place to get vaccinated where maybe people won't speak Spanish with them, that person might have all kinds of reasons why they don't want to do that and be classified as hesitant. On the other hand, when they go to see Dr. Page, if Dr. Page says, I could give you the vaccine and right now, and here's why I recommend it, they could be perfectly happy to get the vaccine there. And so I think you have to think about it on multiple dimensions, not just the particular words. And oftentimes it's a thought of like, it's just the message you give people. And the message isn't bad, and there are certain messages that may be more motivating than others, but it's also your ability to listen and understand what's there. And one of the things that we've seen is there has, under the Biden administration, been a real attempt, at least, to focus on particularly communities of color. And we've seen vaccine hesitancy rates drop a lot as there has been a support for that kind of outreach and listening. I think that the biggest single thing that could be done is probably making vaccine available in more places where people are going to go, where they trust. And that's a bit of a challenge now because of some of the storage requirements for the vaccine. Like in my wife's clinic, where she's taking care of people at very high risk for COVID, if she opens a vial, you got to do 10 patients. Right there. So they're like scrambling to find the 10th. They can't do one. What happens when someone comes back for a follow-up? So some of the technical work to make the vaccine more, accessible and stable, is going to be really helpful to this. But I think getting it into the clinician's hands. So one thing the Maryland Department of Health did well, I got as a clinician in the state, an email saying, are you interested in being a provider for adolescent vaccine? Are you seeing adolescents now? I'm a pediatrician. I'm not seeing adolescents now, but they're trying to look for those trusted places so that people can talk to their own kids' pediatricians about whether to get vaccinated for younger kids. And I think that is definitely a good step. One last quick thing to say is I've been volunteering with the city health department every week since February, going out and vaccinating. And now we're seeing a lot of people like you, Reverend Little, who are coming in, who are a little hesitant at the beginning and then made a decision, to go ahead and do it. And I ask them when I can, when I'm, we're chatting in the observation area, like what made the difference for you? And for a lot of them, it's not interestingly enough, not a scientific judgment that they reached, but it's a person that they answer. They say, it's my daughter who said they really wanted me to be vaccinated. In some cases, it's my mom. There was like a 70-year-old woman who told me her mom told her that she should get vaccinated and she wanted to do that. I say, how old's your mom? 94, So, but it's a person. And you really have to think about not just what the governor says, or but what the word is out there, and how all of us are sharing our experiences and our relationships with others to get people vaccinated.
Yeah, I guess I would just add to, I think vaccines are like many things, right? In any situation, even like let's think of the iPhone. There are people who are early adopters who anything new comes on and they're ready to use it. And other people are like, I'm not sure. Let me see if let me wait and see. And usually the most we talk a lot about trusted messengers. The most trusted messengers are your friends and family and your relatives. And so that's why it's so important to provide access, because, I like Josh and Nationwide, I am also seeing that people were a little more reluctant, and now they're less because they know someone. Like if you didn't know anyone who got a vaccine, it just seemed very, very foreign. But as we have more access and everyone is getting to know someone who got vaccinated and realizes that they're still okay, they're still here, and can talk to them about why they got vaccinated, that I think is very helpful. I think the logistical challenges that Josh has outlined, we're not the only ones, but I know, as at Hopkins and through Centro Sol, but other initiatives, we're doing a lot of pop-up clinics, like just going to places, vaccinating schools, vaccinating even in the clinics, like because logistically, as Josh mentioned, like for example, the Bartlett Clinic where I work, it's just hard to open a vial when people are there. We just had a Saturday clinic and vaccinated 300 people, and then and these are the ways to just get it done. But it is a lot of boots on the ground. It's not necessarily, it's very gratifying, but it's not, glamorous. But it can be done. You need to go where people are. You need to make it as easy as possible, so that if you're even having a doubt, you make it so easy that it's just hard to say no.
Yep. Agreed. Makes sense.
One of the things that I think really works well is the walk-up clinic. I think it's important to recognize that one of the barriers is that sometimes people feel like there are too many steps. But if I've got to go on a website, put my information in, I don't know what you're going to do with my information. I got to wait for you to call me back. I don't know. But if you say, hey, right now, it's available, come. I think that's something that works really well. Another thing that the state Department of Health is doing well, or doing right, is that they are reaching out to trusted voices and stakeholders in hard to reach populations, and engaging them to do outreach within their population. So we're seeing that in the First Nations communities, we're seeing that in Latinx communities, immigrant communities, and the African American communities. And one of the benefits of having so many people vaccinated now is that it's actually safe for those who are vaccinated to go door to door, or to go to events and to canvass and engage people, and to talk about their experience with the vaccine, and to talk about what the reasons that people are hesitant are. So I think those are good practices. I also think that all of the employers in the state, all of the institutions would be well served to follow the models of institutions like Johns Hopkins. I have not been happy with what I've seen from Dr. Sunta's leadership at the University of Maryland Medical System. Hopefully they'll step up their game. I know that the University of Maryland at Baltimore is doing some great work to engage communities. And so I think institutional leadership should be encouraging other institutional leaders to see their role in this. No, they're not government. No, they're not healthcare providers, but they have platforms, and they have consumers, and they have resources, and all of those can be brought to bear. So we're going to be back out on the streets, or we're already back out on the streets, encouraging people to continue to be vigilant. And I think everyone else should be carrying the same message. Be vigilant and do everything you can to reach clarity about the vaccine.
Yep, that makes sense. Great advice. Should people, I don't know, Dr. Sharfstein, if you or Dr. Page, if you've seen this at all, but I'm curious, and I think a couple of people texted us about, the variants, and how worried should people be about some of the variants. We heard a lot about them for a little while. We haven't heard as much recently. How concerned should people be about the variants? Have you been hearing about how Pfizer, Moderna, or Johnson and Johnson are effective against any of the variants? Just curious about your perspective on that.
Sure. So, well, Kathleen, when you go first, please.
Go ahead. It's fine.
Oh, I was just going to say that I just recently had a chance to speak to someone who does a lot of epidemiology into the genetics of the virus to really understand the variants. And what she said is that the variants are, very much easier to be transmitted. And so if you think about the fact that we're kind of in a race between the vaccine and the virus, the variants allow the virus to run faster. It means with less contact, the virus can infect people. With they saw a lot of sports outbreaks in Michigan, for example, before vaccination, because people were passing it on to each other, and it just ordinarily wouldn't necessarily lead to a big outbreak. Suddenly, the outbreak's happening and it's bigger. So it's a pretty serious problem for just in general the problem of coronavirus. The vaccines do provide a lot of protection against the variants right now. They don't work quite as well as they do against the original strain, but there's still a lot of protection, particularly for serious illness and death. Now, at some point, though, the protection from the vaccines will start to wane, and it might wane a little faster for those variants. So this is just a reason in the first instance for people to get vaccinated, because the risk without being vaccinated is so much higher with the variants. And then in the second instance, it sort of requires vigilance of all of us, and the medical system to eventually, make boosters or other types of vaccines that can help us if our immunity starts to wane to them. That would be my perspective, but I will defer to Dr. Page as the infectious disease expert on the call here.
Yeah, I was going to say the same thing. I was going to reassure those who have been vaccinated that so far the vaccine works very well against the variants. I mean, there may be a little bit less efficacy, but really very well against the variants that we know about in terms of protection against severe disease, et cetera. But the key thing here is that, as we have all seen, these variants change all the time. And we can't say that this vaccine is going to work for the next set of variants that come around. And the best way to avoid the next set of variants is for as many people as possible to get vaccinated. This is truly like an action movie. The bad guy is a virus. The bad guy is always trying to change their tactics to try to get into the bank or whatever it is that they're trying to do, right? They change costumes, they change whatever. That's what the bad guy does. The more we have, we allow that to happen, the more chance that this virus is going to change significantly, and then we'll all be in trouble again. So the best approach is to try to get as many people as possible vaccinated. And this, really has global implications. It also means talking about vaccine equity at a worldwide scale. It will do no good if the US is vaccinated, but the rest of the world is not. And so that's a different topic, but in answer to those who are now vaccinated, they can rest assured, but still wear a mask, as Reverend Kobi was saying, because there's still not enough people vaccinated. And the thing we need to do, all of us collectively, is reduce transmission whichever way we can, which is using a mask and getting vaccinated. And that will hopefully slow down the emergence of more variants and more dangerous variants.
That's great. Yep, go ahead.
The only thing that I would add to that is that it's likely that we're going to have booster shots anyway. Right. And so the good news is that the scientific community has figured this virus out, and it'll be a lot easier to figure out the variants now that they have the basic mapping done. And so we should be vigilant. I mean, I think it's, I think both of the doctors have already laid out what happens when we let the variants develop. It's a hazard to us, but I think that we have the tools to mitigate the impact if we use them.
Mhm. Appreciate that. Yep, that makes a lot of sense. Well, this is great. I really appreciate all of you joining. Any final comments to folks that you'd like to leave people with before we end tonight? Maybe we'll go in reverse order. Dr. Little, then Dr. Page, and Dr. Sharfstein.
Well, all I'd say is stay encouraged and stay vigilant. There's a lot of life for us to live, but we've got to be disciplined now, and we've got to operate with the collective interest at heart so that we can all get on with our lives. But we can't skip steps. So keep wearing your mask, do your work to figure out if the vaccine is right for you. If it's right for you, hurry, hurry, hurry and get your shot.
Yep, absolutely. Dr. Page?
Well, I don't know that it's fair for me to go after the Reverend, but
I know no one wants to go after
it's
her.
never fair to go after.
Yep.
But I would say really this has been, I don't need to say this, had such a difficult and long year for so many people. I do think there really is light at the end of the tunnel. I recognize that for many people, the decision to get vaccinated is a personal decision. And there are many reasons why some people may not feel quite ready. But as soon as you do feel ready, please do so. And if you have a good experience, tell someone else, because they're more likely to listen to you than to listen to me. Or to any of us, as a matter of fact. And in the meantime, stay safe in whichever way you can. And I think together we can really, really beat this virus. Thank you.
Thank you. Dr. Sharfstein?
I would just end with a story when I was out vaccinating and there was somebody who was a little bit nervous to get vaccinated, and we talked about it a little. He went through, and I saw him after the vaccine, and I said, how are you doing? He goes, oh, it's good. I'm so glad. It wasn't nearly as what I was fearing. I'm really happy. And I said, well, do you have any questions for me? He said, yes. My wife is in the car. Do you think she can come in and get vaccinated? And so he called her on the cell phone. I ran out. We got her registered. Then she came through, and I talked to her, and I said, do you have any questions? She said, yes. We have another person in the car. Do you think he could come in and get vaccinated? It's like how many people in the car? They can all come in and get vaccinated. So, I think that it may not be that everyone wants to be the first person through the door, but just like Dr. Little, Dr. Pate said, we need to be calling people and telling people what it's like, that it is a great feeling to be protected from this horrible disease, and we can share that feeling with others.
Yep. Absolutely. I will say, I was vaccinated this winter, and I was thrilled to be vaccinated since we were in session. And so I was around so many people. And I felt this huge sense of relief after I had my second shot, and, some time had passed, that finally, right, I could breathe, that I was much less likely to be sick, but also even more than that, I was much less likely to make my husband and my family sick. And then, when my husband was able to get it, it was also just such a relief. Felt like sort of we'd taken a deep breath for the first time in a year, and then experiencing outdoor dining, sitting at a table for the first time in a year was, it's just a sort of this amazing experience. And being able to see people who are vaccinated and not, I think there's still a little bit, a little fear and a little hesitancy. It's still here, right? It's still very real. But the reward, of course, for being vaccinated is my father gets to hug his grandkids, right? And so it's a pretty amazing thing to see. I hope everybody out there will get vaccinated. We've posted in the Facebook where to sign up to make sure that you can go to massvax.maryland.gov. or 1-855-MD-GO-VAX. That's 1-855-634-6829 to schedule an appointment directly. Thank you so much to all of you for joining today. And even more importantly, thank you so much for your work this past year and ongoing. You are saving lives each and every day. And I am so truly grateful for your leadership. So thank you so much. Be well and take care, everybody. Thanks.